Hey guys, welcome back to the show. And today I'm excited to say we have a 5-part training course for PTAs. So I want you to stay tuned over the next 5 weeks to really learn more about PTAs that are looking to step away from their clinical position to work in areas of health, wellness, fitness, and prevention. I'm going to do a 5-part training course that is going to talk about things that you need to understand if you are a PTA that's looking to step away from your clinical position or step away and do a side gig alongside your clinical position. And you want to work in the areas of health, wellness, fitness, and prevention. Guys, welcome back to the show. First topic today is going to be legal implications for PTAs that want to work outside their PTA license. Now, as a PTA, guys, there are legal implications that must be considered before you need to step into solo business ownership. Business ownership, whether you're doing a business full-time or it's just a side hustle, the same types of things need to be taken into consideration if you are a PTA. Now, I want to talk about the legalities with you so that you gain the knowledge that you need before stepping outside and doing something that you think is okay that won't affect your license. Now, I'm not an attorney, nor should this information be considered legal advice from me. I am a PTA. I own my own solo practice, and I have built it from the ground floor up, and I now help PTAs do that same thing. So take this information and please reach out to an attorney to make sure your state, because all of our state practice acts are different, and in your state that you're following the rules that you need to so that you are covered legally. Fitness programs, wellness programs, and prevention programs for people experiencing pain. And if they're experiencing tightness, they carry a unique responsibility and legal implications for PTAs that work outside their professional license. Okay. Considerations you need to understand are your title. Sometimes your PTA board won't let you use your title, which is PTA. So you need to look into, what am I going to call myself? Okay. And what you're going to call yourself is basically also going to merge with, what type of services are you going to render if you call yourself whatever you call yourself. And those two things together are going to decide whether you can actually not just purchase liability insurance, but actually be covered by that policy. When you're considering working outside your license in health, wellness, and fitness, you need to consider your title. What are you going to be called if you can't be called a PTA? What are your service offerings going to be? You need to be able to draft up a screening requirement for your clients. You need to make sure that you disclose that you are a non-PTA patient relationship with this new client just because you are a PTA, so that they don't misunderstand who you are and what service you're rendering. And you need to make sure that you understand your state practice acts when it comes to a PTA performing fitness programs, wellness programs, and prevention programs. And you need to understand this so that it reduces your liability if something goes wrong. Now, it is true, people are seeking care outside physical therapy for pain. They're seeking for tightness, for flexibility, to be able to work out stronger, performance type things. They are looking for this care. And these clients that are looking for this care actually come in with underlying chronic conditions that some are a little more complex than a PTA is trained to treat without a PT. I speak with personal trainers, yoga instructors, massage therapists, and other fitness professionals, and I find that these people are just racing into these providers, and they have a current problem or dysfunction, and they're seeking care under wellness when that PT, chiro, or physician has not given them the care that they felt like they needed, and they're not getting the benefits that they want from these services. So they're really reaching out to non-skilled professionals to be able to meet the need that they're looking for, because there's really not a program in a box. Well, there is, but there's really not a non-skilled program in a box that is available for these people. So they are searching for this type of service. And what they're looking for is they're looking for more long-term solutions that make sense to them and keep them away from surgery. Now, a non-licensed provider of fitness, wellness, and prevention will not be held liable when an injury occurs in their program or class, because they don't have the skill and training to understand how to mitigate that. They don't understand diagnoses and complexities that these people present with. So guys, these personal trainers, these yoga instructors that are not PTAs and don't have a license or the skill, won't be held liable when a person gets hurt, because they don't have the knowledge and skill. A licensed professor, and this is, of course, I'm referring to you, a licensed PTA, you're actually you're held higher. You're held to a higher standard because you're trained, you have a skill, and typical fitness professionals do not have that skill. Now, this higher standard that I'm speaking about typically is referred to as the gray area in your state board and your practice acts. And guys, what I want to get clear today is understand your gray area so that you are not held liable for problems that can arise in fitness, wellness, and prevention services. Now, fitness, wellness, prevention, all of those services for people experiencing tightness that want to gain flexibility is growing rapidly. People are more aware of their bodies. They want to move better, and they don't want to have the surgeries that their mothers and fathers had to get, because they saw that. They saw what they went through, and they don't want that to happen to them. Now, in my Westchester clinic, we see children as early as 5 years old. We see senior citizens as old as 96 years old, and they're all seeking care from a stretch mobility coach for pain and tightness services. And most of these people have already been through traditional methods, and those care methods were more of they set goals that were not in alignment with what these people went and what they wanted to get out of their treatment. So these people are seeking out services to get the rest of what they were looking for when they went to PT, when they went to chiro, and they went to other healthcare providers. And just because they've been through these traditional things doesn't mean it doesn't put you at risk when you're performing these treatments, okay? They are seeking services that are more tailored, more long-term, more specific, and they want to stay away from surgeries, and they want to remain flexible, or they want to gain flexibility throughout their life. Now, a PTA's education, skill, and experience and their scope of practice makes them a preferred provider for these people seeking care for the populations that I just mentioned. Now, as a PTA that has the skills to prescribe fitness programs, and you're wanting to step outside your license and offer these types of services, you need to better understand how these services should be structured, how they're supposed to be reimbursed, so that you minimize your liability. This is very, very important. Now, for this episode today, this is number 1 of 5 different training sessions that I'm going to be covering. And for today's, and in this 5, I'm not covering Medicare compliance. And you guys need to know that if you're a PTA and you're stepping outside your license and you're working in the area of health, wellness, fitness, and prevention, and you're working with that senior population and they are eligible for Medicare, keep your eyes open for more information and specifics, because the Stretch Method and our attorneys are diving deeper into this area right now. But what you do need to know that is very, very important is this population, even as a PTA working in other certifications like a personal trainer, guys, you still have policies you have to follow for Medicare. You still are linked with Medicare, and we're looking into this aggressively right now. But again, I'm not going to go into that with this episode. I just want you guys to stay tuned and really learn what you don't know. Now, in this episode, I really want to talk about liability issues for PTAs. And these are the PTAs that provide fitness and stretching programs for people that are experiencing pain and or tightness. Now, when a PTA pursues additional certifications and they're working towards these certifications to broaden their expertise and to better serve the fitness population, guys, it's essential to recognize that these certifications need to align with your higher license and professional responsibilities. Now, a scope of practice for a PTA, the role of a PTA is pivotal in assisting physical therapy treatments and providing rehabilitative and treatment to patients seeking physical therapy services. PTAs work very closely with patients to implement treatment plans. They conduct therapeutic exercises and monitor progress towards established PT goals. This role is firmly rooted and grounded in evidence-based practices, and it's governed by specific legal and ethical guidelines. Additional certifications can certainly help your skills. They can enhance those skills and expand your ability to address specific patient needs. Certifications such as those like orthopedics, geriatrics, or sports rehabilitation can provide you with a very valuable tool to offer targeted treatments under physical therapy. However, guys, this is a big however. It's crucial to remember that these certifications should not compromise the core principles of your PTA rules and laws. Okay, you need to understand your scope of practice here. The knowledge and skills that you gain through certifications should complement and not replace the fundamentals of your higher license. Let's talk a little bit here about aligning certifications with your PTA license. The biggest advice I can give you is to stay within your scope. Always assess whether this new certification aligns with your PTA scope of practice. These certification guides should enhance your existing abilities rather than lead you to perform tasks that fall outside your legal and ethical boundaries. Make sure that these things are evidence-based approaches, because just as you do in your PTA role, you ensure that the certifications you pursue are grounded in evidence-based practices. This is going to help you to provide safe and effective care while integrating your new techniques. Now, you need to still be collaborative. One of the strengths of the PT-PTA relationship is true collaboration. When pursuing certifications, I want you to consider how they can be incorporated into a collaborative care approach that respects the roles of other healthcare providers. Continuing education. Many certifications require ongoing education to maintain their validity. Use this requirement to stay informed about the changes in your field and to consistently align your practice with your PTA license. Here's some ethical things that you need to consider. To uphold the ethical standards set by your PTA license, you need to make sure that you uphold every one of these standards while you're integrating these new certification, and make sure that you ensure that your choices prioritize patient safety and well-being. All right, so expanding your skill set through certification is very, very admirable. And it can benefit you and it can benefit clients by approaching your certifications with a clear understanding of your PTA scope of practice, and then having a commitment to evidence-based practice and care, and be dedicated to ethical principles. You can actually elevate your practice while by maintaining integrity of your higher license. Remember, your goal is to provide a holistic, well-rounded care that encompasses the strength of both your PTA role and the chosen certification that you have signed on for. Now, if you have more specific information on PTA liability and risk in the areas of fitness, prevention, and wellness, head on over to my Facebook group. It's called PTA Trailblazers. And this private group I established to provide PTAs with the latest information on how to step away from reactive care while staying within your license and your scope of practice. And every Thursday, I'm going to go live in this group at 12 o'clock Eastern Standard Time with many different topics. And these topics are focused on PTAs in order to help empower a PTA and move them towards the information they need to help them advance in their career. Now, guys, also stay tuned for my next episode. And in this episode for PTAs, I'm going to help you better understand malpractice and liability as a PTA, expanding service offerings in the areas of fitness, wellness, and prevention. Guys, I hope that you found this information helpful. Head on over to PTA Trailblazers and learn more about how you can step away and do a side gig or step away full-time as a PTA and expand your service offerings. Hope this show was great for you. Make sure you comment and give us a thumbs up for this information if it is helpful for you. And if you want more information on the services that I provide as a stretch mobility coach and my training program, please reach out to me. Stay tuned again for this next episode in the PTA training series, Understanding Malpractice and Liability as a PTA.